Hi, I'm Bob Wick. I'm a transformation life coach, and we'll get into what that's all about shortly. And I'm joined today by Dr. Barbara Krantz, who specializes in addiction medicine and perhaps even more importantly, the role of the brain in addiction. What we want to talk to you a bit about today is the science around the brain and how it impacts our addiction, but also what we refer to as where the rubber meets the road. And after we go through all of our therapy in whatever facility we go to get work for our addiction, how do we go about living? And what I mean by that is before I finally went to my last treatment center, if you were like me, I was caught in that cycle of recovery. I had gone to 4 or 5 different treatment centers. Every time I walked out the front door, I thought I had it. I thought I was strong physically, mentally, and spiritually. And at some point in the future, I would relapse again. And I got caught in that cycle of recovery. And I had gone to 4 or 5 rehab centers before I finally ended up at the last one that I went to, called Karen Ocean Drive down here in Florida. And the significant difference of this particular treatment versus the others, which enabled me to begin the transformation that I ultimately went through, is I spent a lot of time examining my brain. And I'll never forget the time that it was actually Dr. Krantz and another doctor was with her, sat me down at a table and laid out 3 color pictures of my brain. And what they explained to me was, Bob, yes, you are an alcoholic and you have the disease of alcoholism, a disease just like other people who have diseases, cancer or whatever it might be. But fortunately, with the disease of alcoholism, it was both manageable and treatable. But what they further showed me was where this disease physically was located in my brain, and then discuss some of the treatments that we're going to follow up with to treat this disease. And for me, it was an immediate sense of relief. It was a sense of, wow, that's the reason for all of my alcoholic behavior and for all of my relapses. It was because I have this disease residing in my brain. And it wasn't just me, it wasn't just my behavior, and that negative self-talk that had always been in my head, that you're such a terrible person, you'll never get this, you'll never have a chance of living a clean and sober life. All of a sudden, that negative self-talk went down quite a bit by realizing that it is an actual disease and it is physically located in my brain. So after looking at the initial pictures of my brain, I went through subsequent treatment, work around the brain to get it to the healthiest stage it possibly could be. And this went on for a period of about 30 days. And when I walked out the front door of the treatment center, I must tell you, I had never felt so strong mentally, physically, and spiritually than at that moment. And in my mind, I wasn't cured, but I knew I had a better understanding of this disease, and I was ready to go about living my life. When I got home about 30 minutes later and walked in the front door, I froze. And I felt wonderful, again, mentally, physically, spiritually, but I froze with the thought of being, now that I'm home, what the hell do I do? And how am I going to go about living my life? And I had been through this before. I had been involved in AA, had a sponsor, worked the 12 steps, made my amends, knew the importance of having connections and staying in touch with other people. But the thought that hit my mind was, now what do I do? And very shortly after that, I was fortunate enough to go through a program which is called Transformational coaching. And what that means simply is a transformation back to the Bob that had always existed. And what I believe and what others believe, if you're like me and you're caught in that repetitive cycle of recovery, which is a nice way of saying you're a chronic relapser, but we keep coming back for treatment. Something was causing us to never, never, never give up. I had gone through 5 different treatment centers. I felt great, but the thought that I could relapse once again was still alive inside of my head. And I still had that fear of, is this going to happen again? Am I going to go down that same road? And what I learned is that deep inside of me, I did have my own personal inner hero, my own champion. And I think we all have somebody like that inside of us. We're born with it. But when my addiction became active over the years, I lost touch with that person. I lost touch with that inner champion. But that's the person that wouldn't allow me to give up, that kept bringing me back to these different treatment facilities, and ultimately gave me the opportunity to begin living a clean and sober life. So what began my transformation treatment really began with something I call the 3Ds. And that was taking a look at myself, beginning this transformation with an understanding that I needed the desire, the dedication, and the discipline to take a hard look at my life and to see what was going on and how the brain was impacting a lot of these decisions that I was making. And the 3Ds is really a mental, spiritual, and physical process examining my true desire, dedication, and discipline to live a clear and clean and sober life. Dr. Krantz, having gone through all that and this quick how I got to that point, and the belief that there is this personal hero inside of all of us, and I believe that the desire, dedication, and discipline is something that resides inside of us. How does the brain, how does my thinking impact all of that and my ability to really believe what I'm thinking?
Well, Bob, you bring up a lot of good points. One of which, first of all, it is a brain disease, because the patients that I have seen come into treatment usually come into treatment with a lot of shame and guilt, thinking there's something seriously wrong with me, that I don't know the way out. Their family is upset with them. And once we're able to show them that this is a brain disease, like you discussed, once you saw the deficits that were in the brain showing where the alcohol had affected your brain, then you were better able to forgive yourself, perhaps, and go on with treatment. Like, okay, this is a disease. Hypertension is a disease. Diabetes is a disease.
Right.
I mean, people don't beat themselves up over it. They seek the appropriate treatment and move on with their life. So I think that's an important factor, is actually, where science is today, as opposed to where it was even 20 years ago, is a lot more inclusive and more, and has the ability to identify the different areas of the brain through different testing, through different scanning, through different neuropsychological testing, that will be able to establish exactly where that person is. So it's different for everybody. Now, we don't really see the same results on everybody, but there are certain areas of the brain, especially with relapse. So if you look at where the science is today with relapse, you're talking about 15 to 18 months where there's a chemical deficiency that's being perceived in the brain. So I would bet that your relapse was shorter than 15 to 18 months. So you didn't even make it that far into your recovery.
That's pretty accurate.
Okay. Yeah. So that's a reality, because medically we call it homeostasis, and the brain is not in a homeostatic state. So, and there are things that aggravate that. So negative thinking that you spoke about causes different chemical changes in the brain that don't give you a feeling of well-being, kind of kick in that survival response, like, I need the drug and I need it now. I need the alcohol. This will make me feel better because it's a familiar coping skill.
Right.
So that we see that all the time. So I think it's very important. It's about time that really science and technology have caught up with this disease, because every other medical disease that I have been trained in, we have specific targets, we have specific treatments, we have specific ways in order to help the patient move through it or to live their healthiest life. So again, the shame and guilt, I think, is a big thing, because if once patients really understand that this is a disease, then they're able to move forward with their life. They can have remorse, and it's important. I mean, as far as that, and I'm sure you learned in 12-step facilitation, making amends, all of that. I mean, that's important as you move forward, walking through this disease. But it's important to forgive yourself and know that there's hope. I would assume, and I think you were talking about Dr. A, that was showing you your scans, that you didn't understand that it could be something that was in your brain and that you were purposefully doing this, that compulsive behavior was all you. And yes, there's genetics involved. Research shows 40 to 60% of patients that have the disease, the substance use disorder, have a genetic trait for it. There's, adverse childhood events that occur that increase the risk factors. There's a lot of risk factors in many diseases as well as the substance use disorder. So I think the takeaway for you was that it's in your brain.
Yeah.
It's something that they're seeing that you can do something about, whether it's personality change, whether it's, brainwave changes or connectedness or blood flow issues that you're able to diagnose and treat. And I would imagine that gave you a lot of hope, Bob.
It did give me a lot of hope. My confidence level was still very low. But I was at a point where I felt that if I wanted to grow, if I wanted to actively pursue my sobriety, my head was a lot clearer, a lot stronger. My thinking was better. And I don't know if it was a direct impact of all the brain work that I had gone through at the treatment center, but I know I was thinking clearer, if that's the right word. And my ability to kind of view where I was in a more realistic state felt a lot stronger. And yes, all that negative self-talk that I had beat myself up with over the years, a lot of that noise did die down on the realization that I physically had a disease that was located in my brain that was impacting a lot of my behavior.
And again, what you're describing is a medical model. So we talk about, going from rewiring, because you can change pathways in the brain. You can change the effect of a certain memory in the brain. So with the neurohormone release, that happens when that specific memory occurs. So given, we're, at least in the science of addiction today, we're not just looking at behavioral aspects of the disease. I'm sure you and your family were very much in tune with the behavioral aspects of your alcohol use disorder. But yes, those are consequences and we understand that. But more than that, you're able to, once you saw that the disease was in your brain, then you were able to look at it objectively, because that's objective data. It's not like, oh, you feel better. It's like objective data.
It was real hard data.
Right.
Seeing those pictures.
Hard evidence. And then I'm sure you asked, now what do I do? Did you go through any neuromodulation like neurofeedback?
I went through all of that.
Okay. So neurofeedback is a way to reconnect to normalcy. We can never say anybody's normal, but normalcy, the brain pathways that will help you then attain your goal. And your goal was abstinence and recovery.
That was my goal. And the part I wasn't clear on is, having gone through all that brain work, and walking out of the door of the treatment center, as I said, mentally, physically, spiritually, feeling a lot stronger, knowing I had a healthier brain. Still, when I walked in the front door of my home, I froze. It's like, okay, I've got all this knowledge. I know I have a healthier brain. Physically, I'm in a better place. I mean, I've been sober for 30 days, eating wonderful food in this treatment center. Spiritually, I'm much stronger in my belief system at the moment. But how do I move forward with life?
Well, you're talking about what we say in the field. You're talking about having a structured social support system when you walk out the doors. That's really important because left to, and I am in recovery. I may not have shared that with you, but I am in recovery. If left to our own devices, again, your brain's not on your side. The primary symptom of the disease is compulsivity, that totally irrational, irresponsible,
Yep.
returning to the drug despite losing potentially everything in your life. So it's important that you understand that. And it's important to know that, yes, you've done well in treatment and you understand it's a brain disease, but there has to be a continuum of care. Because if there isn't a continuum of care, you're being short-sighted, I guess, because it just doesn't go away right away. I remember my own personal recovery, and I was in the physician's program, and that was the best thing that could have happened to me because it was very structured and very accountable. So you need that continuum of care in order to get to the place that you really want to be.
And part of that continuum of care for me at that time was my activity within the AA program. And I want to circle back now to what I call this transformational life coaching and how it all ties in. Because mine began shortly after I walked in the front door and I froze. And I went to an AA meeting, saw an old friend of mine, and he wanted to talk to me about this coaching. He was just starting a new coaching program. He was building the infrastructure with a couple of other people that he worked with. And it was all around this transformation thing. And as I said earlier, something kept bringing me back to these treatment centers. Something brought me to this treatment center, my last one, to go through that brain work. And what was that all about? Because what I found out in retrospect, when I walked in the front door and froze, what was missing, and I didn't realize it at the time, was a real sense of hope, a sense of hope that I can actually begin living a life of sobriety. I knew my brain was healthier. I knew I had a sponsor. I knew AA. I knew about the connections, but I just still didn't feel ready to move forward. So what I began was a process of going through this transformation coaching. And what it did, in short, was bring me back in touch with my own inner hero, that Bob that kept bringing me back over and over and over again to all these treatment centers. There was something at the age of 65 that wasn't ever going to let me give up. It kept bringing me back. And it was a wonderful experience to realize that I had that inner hero, I had that inner champion, but there's a series of work I had to go through to get to the point to rediscover that person. And I can tell you, if you're a chronic relapser like me, all the work I did, all the questions, all the therapy center sessions with this new coach, he listened 95% of the time, and I spoke the rest of the time. And what I came to find out is all the answers to the questions I was looking for, a lot of them were inside of me the whole time. I just didn't know how to get back in touch with myself. And I think what happened, if this makes any sense, doctor, is my ability to think clearly,
Right.
and my confidence in myself, my ability, self-belief I could actually move forward, felt stronger than it ever had been. And when this coach says, you're going to get in touch with your inner champion and all that, I said, what a bunch of hooey. But the more we spent time together and the more I kind of let my own voice come out, I did feel this sense of like arrival, that I can do this. This is my time. This is my place in life to finally live this sober life. And yeah, there is a good person inside of Bob Wick that you're ready to come out and now walk hand in hand with me as I move forward. And all I could think to myself is, your brain has been rewired. You're thinking clearly.
And what you're talking about, and I know you're not a physician, but what you're talking about is neuroplasticity, the ability of the brain to change, the ability of the brain to rewire, the ability of the brain to take a negative thought and prune that thought. And we can see it under electron microscope and functional MRIs. I mean, technology has taken us far along.
Yeah.
So that's what you're describing, because then you are able to look at what you have accomplished in life as a person, not business or anything like that, but as a person, who
Yeah.
you really are as a person, and you're a good person. And reframe that memory. And with reframing that memory, you're changing the neuroconnection in your brain, but you're also changing the neurohormone release in your brain. So you're not setting yourself up for failure. You're setting yourself up for success, because the release of the neurohormone is not giving you like, oh my God, I'm going to die, or
Right.
that dread or fear,
Yeah.
where your go-to coping skill was to take a drink.
Right.
Right. Now it's giving you a feeling of well-being. And that's what happens when they do neuromodulation techniques and what we know today about the science of addiction.
And it was a sense of, Bob, you can actually do this.
Right.
So I'm going to end very briefly with some things you'll see on future broadcasts. But when we go through this transformational coaching, what I would be talking about if I were working with somebody to help them rediscover that inner hero. And very briefly, I call it the thriver's journey. But the first thing that we have to do is confront all those deep-seated fears that we have inside that we've been carrying around for so many years. And what I learned, the most important thing, was to how to replace all that fear I had with a sense of true faith. And when I started believing in what I could do and not being fearful of what I couldn't do, my whole perspective on life changed completely. So it's kind of uncovering the truth that was inside of me. What was causing all of this negative thought, all these relapse patterns? There was some kind of behavior there that I wasn't able to control. And I think a lot of that was probably the impact of the brain specific to those behaviors.
The chemical deficiency that the brain was perceiving, and the wiring that had already been well established in your brain. Neurofeedback, if you look at neurofeedback and rewiring, I guess the easiest way for me to explain it to a patient is that if you have a house here and a house here, and there's an overgrown grass and everything else in between, the more you walk from this house to this house, you're going to clear a pathway.
Yeah.
Okay. And that's what the therapy, when you had the neurotherapy, that's what it's doing. It's making a new pathway that's a healthy pathway in your brain.
That makes sense. And part of what I
It does.
do is create a new pathway, though, and getting rid of all those
Right.
old negative thoughts and turning it into something positive. And the goal of that, when I work with somebody in this transformational coaching, is we want to clear out all of that negative baggage that's always been there. Now we have a better understanding of where it's coming from. And the most important thing we can do is rewrite that self-talk, that story we've been telling ourselves for so many years. If you're like me, if you're a chronic relapser, if you're caught in that repetitive cycle of recovery, there's that voice that inside your head that comes from some dark place, whether it's in the brain, around the brain, I don't know the answers.
It's in the brain.
But for years, it kept telling me I wasn't the Saturday Night Live. I wasn't good enough. I wasn't strong enough. Maybe people really didn't like me. But my negative self-talk about being just this awful chronic relapser, you're never going to get it, there's something wrong with you. That story, once we started to rewrite it when I went through my personal coaching work, and turned into a story of, Bob, you are good enough. You are strong enough. You have that inner champion. You have that inner hero. It's been with you your whole life. You just lost touch with them. But now that you're back and alive, your brain is healthy, you can retell that story. And my story that I tell myself today is all about a level of confidence and self-esteem that I never thought imaginable. But when I have those moments, and we all still have them, I don't care how long you've been clean or sober, but you have those trying moments when the thought might pop into my head, boy, wouldn't a drink feel good? Something happens in my mind that just shuts that thought down immediately, and it's powerful.
Well, there's a new pathway in your mind. It's not a coping skill that you have been familiar with now. So you've developed other coping skills to help you walk through those times of duress, or stress out of the blue that you're not, you weren't expecting, or things like that. So it's really important. It's a very treatable disease. And I know when I walked into treatment myself, I didn't have any understanding of what was wrong with me. I knew there was something wrong because I was doing stupid, crazy stuff.
Yeah.
But understanding that it's a disease and it's a treatable disease, like any other disease known to medicine, well, not maybe known to medicine, but any other disease like hypertension or diabetes, any other chronic disease that's there, there's a lot of help for. And there's a lot more science today that helps us pinpoint the areas of the brain and what modalities should be recommended for a certain patient. And I'm sure that's what you experienced if you did the neurofeedback.
Yep.
Right.
Yeah, there are specific modalities. I guess at this point we've gone on a little long. What I'd end with is on future broadcasts, talk more about what the actual steps are in this whole process of transformational coaching, and how I would work with somebody in helping them discover their inner champion, right, to continue in their path of living a clean and sober life. And then from a medical perspective, some of the things we need to be aware of as we go through our day-to-day process of staying clean and sober so that we can live and thrive and enjoy a different life. I mean, I know after all the work I went through, when I get out of bed now, my feet don't hit the floor with a thump. When I get up in the morning, my feet hit the floor and I am ready to seize the day. I want to live. I want to thrive. And my thinking has changed permanently. I mean, this is going on now for a matter of years.
Mhm.
And it was a slow process to begin with. And I don't know, over time, does the brain keep getting healthier? Because I tend to feel stronger and more self-confident as time goes by.
Well, you're making healthier choices in your life, and your ability to deal with stress has changed. You have more ability to deal with stress. And what I got out of all of that is I'm going to be another guest on your show.
Yes, you are in the
Okay.
future.
Okay.
Thank you for your time today. And on future episodes of Transformational Brain Health, which is our YouTube site, Dr. Krantz and I will be discussing further methods to go through this transformation to rediscover your inner champion, and some hints around some brain work, some exercises you can do on your own at home to keep living and thriving. And Dr. Krantz, thank you very much for your time and
You're
your
welcome.
expertise today.
You're welcome. Thank
We
you.
look forward to seeing you on a future broadcast.
Thank you.